Good morning, students. So today we are going to visit a very renowned hospital in Jaipur, that is Eternal Hospital, also called as Eternal Heart Care Center. And in the hospital we are going to see the hospital. Apart from that, we are also going to meet the chairman of Interventional Cardiology, and we are going to talk about the prospects of DM Cardiology, how to get into, what are the procedures, and how a student should study, what are the different branches who can go into DM Cardiology, and after DM Cardiology what are going to be the career prospects, what is the income, what is the standard of life, how life is about after doing this subject. So we are going to talk a lot about these things, and it is going to be very beneficial for all those students who plan to become cardiologists after doing their MD medicine or MD respiratory medicine. So for those who have not been to Jaipur, I would like to tell you that this is the renowned Jawahar Circle, and this is the very famous landmark of Jaipur that is just coming up, the Patrika Gate. You can see it on the right, and EHCC Hospital is located just on this Jawahar Circle. The hospital is just 2 kilometers away from the airport, and it is very much accessible and approachable from all the corners of Jaipur. And this hospital sees patients coming not just from Jaipur and Rajasthan, but also from other parts of India and even internationally, because it is renowned and it is known for its excellent clinical care and outcomes. See the building coming up, and it's a beautiful landmark, very impressive building, and from far only you can make out the good infrastructure, the excellent way in which it is being made, and it is surrounded by greenery from all the sides. The entrance to the hospital, and as you enter the hospital, the first structure that comes is emergency. On the left hand side you can see that we are entering in the emergency, and straight we go to the OPD area of this hospital. Let's go inside the OPD. As you can see that this is the entrance foyer to the OPD. The beautiful sprawling OPD, it houses the main reception, the waiting area for the patients. Eternal Hospital is a much sought after destination for its state-of-the-art treatment facilities, commitment to clinical care, and excellence in the best outcomes. This hospital is established by Dr. Sanjeev Kumar Sharma, American philanthropist of Indian origin and interventional cardiologist, who is presently working in Mount Sinai Hospital, New York. This is his way of giving back to the society, giving back to the country from where he comes from. So today we have come to meet Dr. Sanjeev Kumar Sharma. He's a renowned cardiologist, chairman of Interventional Cardiology at EHCC Hospital. Dr. Sanjeev has completed his MD and MBBS from SMS Medical College, Jaipur, and DM from AIIMS in cardiology. After that, he has also done FACC, that is Fellow of American College of Cardiology, FESC, that is Fellow of European Society of Cardiology, and FSCAI, that is Fellow of Society for Cardiovascular Angiography and Intervention. So today we are going to talk to him, and he's going to tell us a lot about the career prospects in cardiology and how to go for it, how to prepare for it, and what you all can achieve in life after doing this.
Hello everyone, I am Dr. Sanjeev Sharma, Chairman Interventional Cardiology at Eternal Hospital, Jaipur. Today I would like to share my journey, how I became a cardiologist. There was a time in 2000-2002. Those were the years when we had a limited number of DM cardiology seats available in the country. Only few institutions used to provide that: AIIMS, Delhi, PGI Chandigarh, PGI Lucknow, Suchitra Trivandrum, Jaipur Pondicherry, and few of the medical colleges like Lucknow and Kanpur, and Jaipur just started that. So all the students who had a clear passion to become a cardiologist were those who used to have a passion for the internal medicine first, very hardworking. All the time they used to be in the books, because those were the times when we had limited number of seats for the MD medicine also, and also for the super specialty. So I had a clear passion that I would like to become a cardiologist, and whatever time it takes and whatever energy and hard work it takes, I'll do that. And we used to study very hard as a group, as an individual, as a group discussions, and those were the days when we did not have any kind of a coaching courses. So after MD, we studied very hard about the real textbook cardiology, Brownwood textbook of cardiology, and then we started fighting for the competition. And there were the times when you qualify for the examination by the theory, but you couldn't clear the practical exam. Suppose there are 2 seats, you are first waiting, you're ranked 3. You are first waiting for the 2 seats, and that used to be the scenario during those days. So I was first waiting for the PGI Chandigarh, then I got into the 5th rank in JIPMER hospital, tie equal marks. Then on the basis of MBS marks, the seat was given to some other candidate, and then I qualified for the AIIMS DM entrance. There was 1 seat, and 3 candidates qualified for that. One of the internal candidate MD medicine from AIIMS, he got the seat, and I was first waiting. The very next exam, after 6 months, I got through. So those used to be struggle. You had to study hard, you had to work hard, you had to have passion, and never lose the hope of consistent hard work. So after 6 months, it doesn't matter if you take a little extra time to qualify and clear the exam. And then we used to get into the AIIMS. Once you are there, and then you know that you are in elite class. You got into the AIIMS cardiology. Then after 3 years, you become a cardiologist of reputed institution, and then you have all the doors open for the best of corporate hospital or any academic institution where you want to get into, whether it's an academic field or it's an interventional field. and then your doors open for the future fellowship in specialized cardiology. Like these days, after interventional cardiology or cardiology DM cardiology course, you can opt for the interventional cardiology course in terms of FNB or fellowship in interventional cardiology provided by the National Board of Examination in India. And also you can apply for fellowship in interventional cardiology at other institute in US. But for that you need to clear your US level exam before applying for that. And there are students who does that. And after clearing those interventional cardiology fellowship, even US, it's a 1 year or 2 years course, and after that, then still you can opt for the next level. You would like to go for the structural heart intervention fellowship or EP fellowship or heart failure cardiology or transplant cardiology fellowship. There are different fellowships, and that is the further specialized field. And once you get through that structural heart fellowship or heart failure fellowship, then you become a super specialized person, and you get a best of job in any part of the world.
So what advice would you like to give to the students who want to go for DM cardiology, who want to prepare for it and then become a successful cardiologist?
Cardiology is a evergreen branch. All the students who opt for the cardiology after MD Internal Medicine are those who are really, they have a passion for it, because this requires a lot of involvement in terms of your personal time, and your fitness and your family time is also sometimes at stake, because you have long hours of working and you have to come in the middle of the night for emergency procedures. But if you are into it, you really like it by your heart, then it's all possible for you. And once you've done the DM cardiology, then you're financially, the finances are secured, you have a good quality of life, you earn a good amount of money, and at the same time you get a good satisfaction in terms of profession. The professional satisfaction is there. Once you treat a patient who comes to your emergency with an acute heart attack, with a shock-like condition, that if it doesn't come to your hospital, he will die within half an hour or 1 hour. Those patients, when you save by doing an emergency intervention, like putting on a intravenous pump, heart pump support, and then you open up the vessel, do emergency angioplasty or emergency surgery, these patients, once they survive, then you have a great professional satisfaction out of those patients. So if you have a drive for doing something which is very saving the critical lives, but you want to spend extra hours in the hospital, you are not scared of coming in the middle of the night year after year, if you're passionate like that, then the cardiology branch you should go for.
Now that there is the super specialty exam for the students, MD students who want to go into super specialty courses, so how they should prepare for it? Whether they should prepare for it by leaving all the jobs and sitting at home and just preparing, going 24/7 into studies, or they can do some job and along with that they can prepare. So what is your advice on that?
For clearing any tough entrance exam, just like DM cardiology branch, you have to have the definitely passion for the subjects that you want to clear. It's not like you have to sit for the long hours and then only you can clear an exam. It's about smart hard work. If you are into job, you can do your job dedicatedly, and at the same time you should squeeze out a little bit of time for study during your working hours, and after that you should spare at least 6 to 8 hours dedicated, focused, and very methodical learning, because there are students who are sitting idle at the home and working hard, reading multiple times and doing MCQs, still they couldn't clear. And at the same time there are students who are very focused in spite of hard work in the hospital, still they can study very focused, very smartly in those 6 to 8 hours available, and they crack the exam with a good rank. So it's all about smart hard work. You should deliver the result. That is most important. And for that, every single individual student is a different. So you have to clearly analyze your capabilities, how you want to approach, and what has been your past. And you can make out what kind of student I am. So you have to focus on those areas you need to work on. And while working, like for me, there were students with me who used to have less study and they used to crack the exam. And they were working in the hospital. But whenever they go back to home, in 2 to 3 hours, they used to be very specific, very focused, and they used to clear the subjects thoroughly. And they used to clear all the MCQs very easily. So it's all about how you approach while studying. You have to judge yourself and adjust the study schedule accordingly. Even during working hours, you can squeeze out a little bit of time, and the patients, what you are seeing a patient with suppose heart failure or a patient with a myocardial infarction, you study at the same time. See the patient and you study, and you can remember it better. You can correlate. You can digest that better. This is kind of analytical type of learning, and then you can apply same kind of knowledge and you clear those MCQs at the same time. So these are smart working. So working is not a burden for you. At the same time, you are earning for yourself, and also you are strengthening your knowledge, and you can clear the exam in a very easy way and get a good rank.
So for students who are desirous to take admission or DM cardiology in AIIMS or Institute of National Importance, what advice will you give to them to how to prepare for the theory exam, how to prepare for the practicals and the interviews? For
AIIMS, PGI, PGI Lucknow, Institute of JIPMER Pondicherry, First is the theory exam you have to clear. So for that you need to have very good sound theoretical knowledge to crack the exam and be in the top level. And once you clear that, there are different type of slabs everywhere about the practical. Like in AIIMS, we used to have 50% theory and 50% practical. And in other institute, it can be 70-30 or it can be 80-20. So different institute have a different theory and practical weightage. But theory is the first thing. For that you will be thorough. Once you are in the practical, then you have to be very specific in giving answer. When you know about the subject, but you are not able to communicate it clearly, that really makes you a little down. And at the same time, you cannot afford to be arrogant. Don't try to show your smartness that I know everything. You have to be humble, polite, and answer in a very methodical way that you know about the subject. And then let your interview go one by one. Like at times you have different examiners sitting in front of you, 6, 7. Each one of them is asking one by one question. They usually have a very specific agenda. They want to know your knowledge and then how you apply that knowledge in a practical scenario. And then also that you are not like showing your that I know everything. And this is about your interview part. But at the same time, there are few institutions, those have your spotting type of, there are weightage for the spotting, there are 6, 8, 10, 12, 15 spots are there of the different ECG, ACO findings, and all other type of specimens were kept. So if you are good in theoretical knowledge, you know about everything, you can easily answer that. So spotting is not an issue. Only thing is about your temperament and how you answer during your practical interview examination. In Cath lab, we deal with the cardiac patients and heart patients. Whenever you talk about the cardiovascular disease, majority of the patients we treat with the coronary blockages, we say it's a coronary heart disease, comes with a blockage with unstable angina or heart attack or acute coronary syndrome. We do angiography. This is the Cath lab setup. This is a console. This is a Cath lab table, and there's a panel in front of us. In a small local anesthesia injection in the hand artery, radial artery, we inject, and then we take an access. From that, we advance the catheter to the coronary arteries, and we check by giving injection selectively to left and right heart artery. And then we get the idea about the blockage, which vessels cause heart attack, and how best we can treat. And after detecting the blockage, we advance the wire and set the clot that with the balloon and put a stent. We say angioplasty. So these are the most common procedure in the Cath lab: coronary angiography and coronary angioplasty. Patients who have got multiple blockage, in those cases, we go for the open heart surgery or bypass surgery, what we say. The other common cardiovascular problem is the valvular heart disease. When you have a valvular problem, we have 4 valves, 2 on left, 2 on right. Left side valve problem are more common: mitral valve disease or aortic valve disease. Aortic valve disease, earlier there used to be open heart surgery only. These days, we replace it with a transcatheter aortic valve replacement therapy. For that, we go with the groin, give injection local anesthesia, and from the groin access, we advance the valve across the aortic valve, and then we deploy it. So now we'll go to the pre-Cath and post-Cath area, where we keep patients before the procedure and also after the procedure for the monitoring. Now this is our radial launch. Radial launch, these days all the angiographies are a day-care procedure. So we call the procedure in the morning, and we do pre-Cath investigations. As soon as we get the reports, they're okay. We do the angiography radial route, and after 2 hours of observation post-angiography, we discharge from here. This is the radial launch, so within 4 to 6 hours, we can discharge the patient after angiography. This is our command area. This is a pre-Cath and post-Cath. The procedure, we keep the patient here and keep the patient and check for all the investigations for the fitness for the procedure. Once all are okay, we take the patient to the Cath lab for the angiography or angioplasty. Once procedure is done, we get the patient back to on the same area for the monitoring for next 24 hours. And once 24 hours patient remains stable, after angioplasty, we shift the patient to the rooms for the further observation next 24 hours. Then he can be discharged from the